Traditional Medicine, Is It Applicable Today? By Farhad Purgorafshan. May 8, 2004. It was a part of a conference at the Ryerson University in Toronto related to traditional medicines. Increasing use of traditional medicine. Alternative healthcare industry has grown to about $22 billion a year. The number of Americans using complementary alternative medicine, CAM, has grown to 83 million in 1997, up from 61 million in 1990. 33 billion was spent on CAM products and services in 1997. Questions inadequately answered. Why did traditional medicine lose its scientific and popular acceptance? What is traditional medicine? How applicable is it today? Traditional psychology and psychiatry for the modern world. My doctoral thesis is dealing with the above three questions. It was published in 2012 as a book available on Amazon. And it's available in 4 languages. Why traditional medicines seem to have become obsolete? The cause. Historical causes are of politics or political nature and economical nature. Philosophical causes. Historical philosophical causes are the Renaissance, empirical, humanistic, anti-clerical, anti-monarchical, had devastating effect on all traditional sciences, not just the medicine, but specifically on the medicine. The new interpretive tools for science, Cartesianism, Darwinism, and evolution also had their devastating effect. Cartesianism. Its mechanistic view of the world is in direct opposition to the holistic view of the world. The data do not speak for themselves. I have been in rooms with data and listened very carefully. They never said a word. From Clark and Willermuth. Darwinism, evolutionism. Materialistic in essence, as an interpretive tool, has no effective value for traditional medicine in dealing with the wealth of biological data discovered through modern technologies. For example, when biological data states that if an axon's myelin sheaths deteriorates, its signals may not be transmitted effectively, the loss of muscle control seen with the disease multiple sclerosis is due to degeneration of myelin sheaths. A traditional school of medicine, such as TCM, needs to understand, first, the physiology of myelin sheaths and its relation to its yin-yang and zhang-fu theories. Second, TCM needs to understand the etiology and pathology of myelin sheaths in the light of its own theories before it can provide diagnostic criteria and consequently a treatment. TCM may reason as such. Myelin sheaths, being the outermost layer, corresponds to yang. As a part of the nervous system considered as the extension of the brain, which TCM considers marrow, it is related to the kidneys according to Zhang Fu. Therefore, so far we have concluded that kidney yang is a part of the pattern. TCM may reason as such. The myelin sheaths prevent the leakage of electrical currents from the axon. The spleen in TCM is responsible for preventing leakage of blood from the vessels. The two functions closely resemble. Therefore, one concludes that the spleen is also a pattern of the pattern in MS. TCM may reason as such. TCM considers the liver to be responsible for the smooth discharge of energy throughout human body. Myelin sheaths play a vital role in distribution of electrical signals throughout the nervous system. Therefore, the liver becomes a part of the pattern in MS. Way before any relation between MS and myelin sheath deterioration was discovered, TCM classically considered two basic patterns for MS: damp phlegm with spleen deficiency, liver and kidney deficiency. This is according to Machiuchio, one of the greatest Western authorities on traditional Chinese medicine. Therefore, TCM's interpretation of this recent data, in this case, only confirms its earlier conclusions based on its own diagnostic criteria. Consistency of this phenomena could be further investigated. On the present state of Islamic medicine, Nasr 1976 writes that as a result of the westernization of medicine throughout the Islamic world, traditional Islamic medicine and pharmacology had only survived in the subcontinent of India. Questions inadequately answered. Why did traditional medicine lose its scientific and popular acceptance? What is traditional medicine? How applicable is it today? What is traditional medicine? There is widespread confusion as to what is traditional medicine. Terms such as alternative medicine, complementary medicine, and traditional medicine are used as being synonymous. The opportunists take advantage of this prevalent confusion in an attempt to make a quick gain and invent claims for such and such a natural remedy or ancient treatment. Some promoters of these so-called alternative medicines make claims to have the cure to everything. Many treatments are claimed to be an ancient cure for a disease or for all disease, and the list is growing. Frequently, such claims fail, sometimes after harming the patients through inappropriate or toxic treatments. These failures are then used by the opponents of traditional medicine to discredit them all, but it's the failures of the opportunists who are not really experts in traditional medicine. Therefore, it is necessary to establish a set of criteria to identify traditional medicine. Set of criteria to identify traditional medicine. It has to have a doctrine of the universe that is not materialistic or mechanistic, but it is rather holistic. Meaning, it believes that the universe is an integrated whole or an organic entity which cannot be understood simply through an understanding of its parts. Set of criteria to identify traditional medicine. Again, continued. It has to have a historically long and unbroken chain of academic or master-disciple record of transmission. A traditional medicine must have a formal education and or training as a prerequisite of practicing that profession. It has to have a comprehensive and consistent theory on etiology, diagnostics, and treatment principles of disease. It has to have a historically long record of clinical practice and a prescription compendium and a materia medica. The various systems of traditional medicine, according to McGirr and Stoddard. Ayurvedic medicine, India. Acupuncture, China. Shamanistic medicine, Tibetan, North American Indians, and other Hyperborean peoples. Spagyric medicine, Greco-Arab. Animistic medicine, Sub-Saharan Africa. Spagyric medicine, The practical side of Greek medicine was called spagyric, a term derived from the alchemical formula salve e coagula, the Greek equivalent being span, to separate or dissolve, and Agirian, to assemble or coagulate. Disease was conceived of as a rupture of equilibrium or as a deviation from normality. Greek medicine was based on the theory of the four humors: black bile, yellow bile, phlegm, and blood. The theory of four humors was first expounded by Empedocles 490 to 430 before Christ. The Greek theory of the four humors was an integral part of the systems of Hippocratic and Galen. The Greek theory of the four humors was approved by the monotheists, Jewish, Christian, and Muslim alike. In the Islamic world, the chief schools of spagyric medicine were at Jundishapur in Persia and Alexandria in Egypt. The Islamic physician best known to the West is undoubtedly Avicenna, 11th century AD. Avicenna. Whereas Hippocrates had been called the father of medicine, Avicenna earned the appellation the Prince of Physicians. His main work was the Canon of Medicine. Written in Arabic, it was soon translated into Latin and exerted considerable influence throughout Europe for several centuries. The Canon of Medicine is comprised of 5 books and 7 volumes. The amount of information is too vast to be reviewed in this paper. Avicenna's approach to psychological disorders is solely based on the clinical presentations of the patient. Some physicians believe that schizophrenia is caused by possession by the jinn. Whether schizophrenia is caused by the jinn or not, the patient's temperament becomes atrabilis, that of black bile, melancholic. These are the discussions from Avicenna and his solutions or treatments being offered. Therefore, its immediate cause is presence of pathologic black bile. Schizophrenia is often due to penetration of black bile into the vessels, but mania is often due to generation of black bile in the frontal of the head or the substance of the brain. At the early stages, the main cause of schizophrenia and mania is corrupted blood. Treatment of mania, according to Avicenna. If it is due to repletion of the humors, then bleed the vein. If the biles have taken over the body, its signs you will know from the urine and other symptoms. Then for yellow bile induced black bile, use the decoction of the minor sauce or decoction of myrobalan to purge the bile. For the case of simple black bile, simply purge the bile using the decoction of minor sauce only. After more than a century of struggle, the Diagnostic and Statistical Manual of Mental Disorders DSM-4, which is now DSM-5, of the American Psychiatric Association has taken the exact same position, where it has adopted an atheoretical approach to psychological disorders. It defines the criteria for diagnosis of psychological disorders according to the clinical presentation of each disorder, and not whether the cause is psychological or physical. Traditional Chinese medicine. Flawson Lake writes, till now, many Western students and practitioners of Chinese medicine have believed that modern Chinese medicine is primarily a somatically based medicine and that it gives scant attention to psychological disease. The link between DSM-4 and TCM anxiety disorder, as an example. In DSM-4, criteria are A. Excessive anxiety and worry. B. The person finds it difficult to control or stop the worry process when desired. C. The anxiety and worry are associated with at least 3 or more of the following 6 symptoms. D. The anxiety or worry is not about having a panic attack, being contaminated, or gaining weight. DSM-4 again continues by restlessness, being easily fatigued, difficulty concentrating on mind going blank, irritability, muscle tension, sleep disturbance. In TCM, the diagnostic criteria are Yang hyperactivity, fire, vacuity fire, deficiency fire. Spleen chi blood vacuity, fire, deficiency of spleen, blood, and energy. Spleen chi blood vacuity, again this one the same without the heat or fire being a complicating factor. Liver chi stagnation, stagnation of energy of the liver not spreading throughout the body properly. Liver wind, wind in the liver. Blood yin vacuity, deficiency of blood or yin. Blood chi yin vacuity, yang hyperactivity, fire. TCM, causes of psychological disorders. Yan Dexin, the renowned 20th century doctor of Chinese medicine, states, through extensive research and clinical experiments, including various blood tests, concluded that static blood is the chief mechanism of senility. Dexin, psychological disease, Jin Shen Bing, belongs to the category of mania and withdrawal. Dian Quang is the category of disease in Chinese medicine. The ancients already knew that its occurrence is related to static blood. Impedance of microcirculation, blood circulation in the body, or blood corruption. In Shanhan Lun, treatise on damage due to cold, there are passages where heat binding in the bladder, heat entering the blood chamber, and retained of blood are all clearly spoken of in terms of the relationships between mania and blood disease. Conclusion. Interestingly enough, what Avicenna had suspected to be the cause of mania, namely corrupted blood, see spagyric medicine above, is strongly supported by the research of Dexin 1995 that uses modern blood tests together with the diagnostics of traditional Chinese medicine. This is just one example of the wealth of practically important information and insight from traditional medicine that could lead to medical breakthroughs in treatment of psychological disorders. 5 recommendations. There is a need for extensive translations from the original sources on traditional medicine. Those who have received formal and recognized training in traditional medicine and practice it must do the translations. Translation should be done by qualified people, not any translator. Government, private sector needs to support the centers providing or planning to provide formal education in traditional medicine. The practitioners of traditional medicine be well visible and represented within the regulatory and policy-making agencies dealing with the status of traditional medicine. Research centers to be funded and established by the government or private sector that primarily investigate traditional treatments. Within these centers, cooperation between traditional practitioners and modern scientists is a necessary factor. Recommendation 5. The criteria proposed by this study be used as a basis for identifying reliable and authentic systems of traditional medicine and psychology to prevent false and inaccurate claims on behalf of traditional medicine. These recommendations were finally adopted after a few years. This conference was presented soon after by Canadian government, which actually brought in regulatory system for traditional Chinese medicine and started licensing the practitioners. While before they were exempt from licensing, they could practice legally, but they were not having a regulatory body supervising them. And after that point, no one could practice acupuncture or herbal Chinese medicine without being licensed, which had to pass through the qualifications, educational, and training, practical trainings. This is the end of the presentation.